A recent study published by the CDC has provided some startling results in terms of how the U.S. ranks internationally on infant mortality rates. The study placed the United States 30th in the world, well behind Japan, France, Germany, and England. These disappointing results have sparked debate over whether this ranking is an overall indictment of the current healthcare system in this country. Joining us to make sense of it all is ABC News Senior Health and Medical Editor, Dr. Richard Besser. Dr. Besser, thanks so much for coming back on the show.
Nice to be here.
So these are pretty shocking numbers, placing the United States 30th in the world. What is to account for this?
You know, it is concerning. This isn't the first time the U.S. is ranked low like this. But the fact that we spend more than twice as much per person as any other country in the world on healthcare, and we rank 30th in infant mortality, I think that it is a real. It says something about our country and what we really focus on.
Could this be considered a wake-up call of sorts, or?
Well, I think so, because infant mortality is something that encompasses so much. The factors that lead to high infant mortality really cut across so many aspects of health care and poverty and disparities. Right. It's a really important figure to pay attention to.
And now it's my understanding that preterm births are to account for this high number, correct?
Yes. If the United States has a very high rate of preterm births. Every year, over 500,000 babies are born prematurely. 1 in 8 pregnancies ends in a premature birth, compared to somewhere like Ireland, where it's 1 in 18.
Why
Big
is
difference
that?
there.
Why is that happening here, that so many premature babies are being
Well,
born?
many factors that go into prematurity, and that's where you can kind of use it as a broad indicator. Women who are very young, teen moms, are more likely to have a premature baby. Very old women are more likely. Those who've not had prenatal care. Many of the factors that lead to prematurity have to do with underlying medical conditions. So if you're pregnant and you have high blood pressure that isn't controlled, that will increase the likelihood you'll have a premature delivery.
Now, we know obesity is on the rise in this country. Is there any link between obesity and?
Well, obesity can link to pregnancy complications. I don't know how closely it links to prematurity. Actually, if you have diabetes, you can have a baby that's quite large and have complications from that. But the idea that a lot of women in this country don't see a doctor before they go into labor, that's a problem, because there's so many conditions that could be detected and controlled during pregnancy.
And is the reason for that a lack of education, or is it poverty, a little bit of both?
Both of those are risk factors. So women with less education are more likely to have premature babies. Those women who smoke or drink alcohol or use drugs during pregnancy, again, a risk factor for prematurity. So it is a really good global indicator, and the fact that we haven't gotten worse since 2000. We were ranked number 29 at that point. So 29 to 30 isn't much of a change, but the idea that we as a nation haven't improved on that indicator really says something. It says that there's something broken in our system.
It is alarming, especially considering how much money is spent on health care in this country. Is this then an indictment on the healthcare system in this country?
Well, I think the fact that not everyone has free and ready access to health care is a big problem. And if you look at the group of people that's least likely to be insured, it's the kind of healthy young adults who feel that they really don't have medical problems and don't need care. Well, if a woman falls into that group and gets pregnant, she's missing out on some of those key services that could reduce the likelihood she's going to have a premature delivery.
And now there are some that say that this listing